Okay, so we are going to get started here. Good evening, everyone. Welcome to the fifth in the series of Straight Talk community conversations about COVID-19. We want to welcome everyone to tonight's online community forum. We will be talking about the coronavirus and how it is impacting people in our community. My name is Pamela Duncan, and I am the President and CEO of Metropolitan Development Council. I'm joined today by my colleague, Twina Nobles, President and CEO of the Tacoma Urban League, with whom we are partnering for this series of conversations. Twina.
Thank you, Pam. Can everyone hear me okay? Excellent. Tonight's conversation is the fifth in a series of discussions where we are diving into the different ways that the virus is impacting Tacoma and Pierce County. Tonight, we have a panel of experts addressing the disproportionate impacts of COVID-19 on communities of color, both here in Tacoma, as well as across Washington State and nationally. We will hear from the community, we will be here for the community throughout this COVID-19 crisis with new conversations every Monday at 5 p.m. And I welcome you all to join us on Zoom every Monday at 5 p.m. The most important message throughout this series of conversations is that there is hope for our community. Our focus every conversation is to create a space in each of these meetings to talk about resources and things that we can all be doing to help get through this pandemic. I'm now going to turn it back over to Pam, and we have a very exciting panel for you tonight. Thank you, Pam.
Yes, and we are very excited about the conversation this evening. We have some great panelists lined up. And throughout today's conversation, you can submit your questions to be addressed by our speakers using the question and answer function in Zoom. We try our best to consider every question. We may not be able to get to all of the questions, but we will give it our best shot. And then as a housekeeping matter and for the security of everyone on this call, everyone's mic has been muted with the exception of the panelists, and we are not allowing anyone to share their faces on video. We have also disabled the chat function, so please submit your questions to our moderator through the Q&A function. And we will be checking that throughout tonight's conversation. And I will again remind folks throughout periodically to just submit your questions or your comments through the Q&A function. So on the call with us tonight are several great individuals in and of themselves. So we have Marc Dones, who is with the National Innovation Service. Many of you may remember Marc from when Marc came to Tacoma and Pierce County to help launch the Spark Report, supporting partnerships for anti-racist communities, and to really help elevate our collective awareness about the intersectionality of racism and homelessness. We also have on the call Manny Santiago, who is with the Washington State LGBTQ Commission. And we have Jacques Colon with the City of Tacoma, who oversees the City of Tacoma's 2025 strategic plan. So I just want to welcome all of you to this call. Thank you so much for making the time. And this is going to be a great conversation. Can't wait to just dive in. So we are going to get started and just start with, if we could, with just give us an overview about the social determinants of health, because that will help to really set the stage for wellness and what the commonly accepted framework for anyone's wellness looks like.
I'll jump in and start. So in my former life, I was the health equity coordinator for the health department. And when we looked at all the data for when people died and where they died and how they died, what you end up finding out is that it's actually a very small percentage of what makes people's health that's determined by clinical care and doctors and hospitals and access to care. That really, when you look at it in a big picture way, it's the vast majority of our health is determined by social, economic, and environmental factors. So when people say social determinants of health, what they're really talking about are the social, economic, and environmental factors that we live in every day. And what that means in real life is the housing that we live in, the transportation that we have access to, the jobs that we have access to, and unfortunately, the color of your skin right now plays a big role in what kind of opportunities we get across all of those different sectors. So social determinants of health really are the majority of what make people healthy or not. And you can see that whether you're looking at racial lines or zip codes. So a lot more to dive into there.
So what makes that so significant when we talk about communities of color? Because that's really what the crux of this conversation is about. So what does that mean, Jacques or Marc, when we begin to talk about the intersectionality of health?
So I can take that to some degree. I think so. To pull what you asked in the first question forward into this one, I think that like one of the things that we have to do when we talk about well-being is also look at the way in which systems are designed, right? So like that's my focus is like thinking about how systems are designed, like how they are structured, yada yada yada. And I think that like when we talk about social determinants of health, there often is still a little bit of an onus on behavior, right? And like how behavior interacts with structural forces around it. But like there's also this idea, I think, at the core that people's choices are choices. And I think that oftentimes, like when we think about well-being frameworks to their highest function, what we see is like most choices are not in fact choices. And systems are actually designed to sort of move people into very narrow, what we call choice logics, without, just very narrow choice logics, right? So like at the end of the day, what looks like a choice from a wide array of options is actually a very narrow choice that is predetermined by a bunch of systemic functions. The reason why I want to sort of pull that forward is that if we're thinking about well-being, what I want us to think about is like, what does it look like for systems to focus, right, on the creation of thriving rather than the elimination of negative aspects of life, right? So like, again, oftentimes when we think about like what we're building, we ask ourselves, like, what are we trying to get rid of? Like, I'm trying to get rid of homelessness. That does not tell me that I'm trying to create a thriving Black community. And those are different things, right? And so what I want to think about in this moment, right, inside and I like picking up like the idea of hope, right? Like underneath the pressure of this pandemic, I think we've seen systems sort of show their true faces, for lack of a better term, right? Like the narrative of like system failure, I think, is functionally incorrect. What we actually have is systems that are designed to be racist, designed to be misogynist, designed to be transphobic, designed to be homophobic, right? And they have always been designed that way. And underneath the pressure of this pandemic, all the Band-Aids we've put on them over the last 150 years are dissolving. And so they're just reverting back to their true form. There is an opportunity in that, though, right? To say like, okay, I see what this is, and I want to recognize that there is, we can do something else, right? We can create systems that are focused on well-being, that are focused on the creation of thriving and safety as defined by the communities, right? And that, I think, is actually one of the most interesting potential opportunities in this, right? Is like, we actually could, and there is, I mean, like, it's not like there isn't like there's a dearth of information. I think it's like a dearth of information that's codified in sort of white dominant academic ways, but like, people know what safety feels and looks like for them. They know what thriving feels and looks like for them. And there is an opportunity right now to design systems that architect towards that strengths-based reality, instead of simply trying to negate a negative, right? Or cancel something else out. So that to me is like some sort of the opportunity space here. And when I think about, like, you know, what does it mean to think through social determinants or think about well-being, I often go to a place of, well, can we actually go past that, right?
Jacques, Manny, would you like to add anything to the social determinants of health or historical perspective before we shift a little bit? Go ahead.
Sure. I'll just say that when you talk about all those different social determinants of health, you can't have that conversation without acknowledging all of the past layers of injustice that have created the racial inequities that we see in those areas. So when I hear Marc talking about choices or the illusion of choices, I think that's a great example when you look at housing, for example, and the quote unquote choices that communities of color had to make about housing, or choices about education and the level of funding that education systems received. So I think that is absolutely where the conversation has to start. And then with that acknowledgement, I think there is a pretty clear line to recognizing that, you know, community partners, but government centrally has a responsibility to take intentional steps towards addressing those racial inequities that have been caused in large part by government policies. And so for each of those social determinants, I think it's really important to think about ways to build in an intentional racial equity lens, but also action. It's not just a lens. And so, you know, Marc talked about the difference between ending homelessness and building thriving Black communities, right? And intentionality has to be played in both of those spaces for it to work. So when we talk about responding to the COVID-19 crisis that our community is facing, you know, when it comes to housing, you have to look at programs like rental assistance. And I know the city is trying to be very intentional about how we're building our rental assistance program, to say there has to be a set aside specifically for families of color, because we know that families of color have been disproportionately put into positions of being renters in the first place, of not building home equity, and additional layers of social determinants. And I think that cuts across multiple layers. So if you've seen the small business loan and PPP numbers from across the country, you'll know that, you know, small businesses that are minority owned are disproportionately unlikely to receive that federal aid. And so again, I think local governments and community partners have a responsibility to be intentional about recognizing, if we do also want to build a thriving Black community, but also Latinx community, also Asian community, just all of our communities, if we want them all to have an opportunity to thrive and build the social determinants of health that we know are necessary to have a thriving city, that has to be built across all of those different layers.
And I want to keep this open, Manny. I see you're unmuted, so I will let you speak. So I'll keep this open, but just so you all know where we will shift next, we want to move this conversation once we've heard from everyone to what we're seeing nationally, how we are seeing communities of color impacted nationally. But let's continue talking about the historical perspective and also the importance of understanding the social determinants of health. Manny, go ahead. Thank you.
Yeah, so I wanted to add some of the perspective of my own Latino community, and I agree with everything that Jacques and Marc have said. And one of the things that is important to us as a Latino community is our understanding of family, right? And the the way in which we understand family, which is a very different way than other cultures and other contexts. And that certainly affects not only the physical health, but also the mental health of our community. And in this case, in the COVID-19 crisis, we're actually seeing how the Latino community is being affected because of, among many other things, the way in which the system in which we have to navigate doesn't recognize the reality of the concept of family for our community. So for instance, and when Marc was saying about the perception of having choices, the truth is that we, within the Latino community, excuse me, we don't have many choices when it comes to where we can work, right? Or what type of work our community does. And yes, these are generalizations. However, they're very prevalent within the Latino community. The type of jobs that we have, the types of jobs that are available to our community are determined by the type of education that we have access to, the quality of education when we get to have education opportunities. And then in addition to that, how that ties into a family that might be of mixed status, and some of the workers have been laid off and don't have any financial support system from the state or the federal government, and don't have access to other assistance. And then on top of that, you live in a community. You don't live in isolation, and you don't have this concept of, you know, my neighbor who happens to be my family member cannot visit me. You know, that is just not understandable in the Latino community. And I'm not trying to say that we're ignorant to the risks that it comes with, you know, having family over, things like that. But our understanding of family is such that we cannot perceive the complications and the risks in having the family, the quote unquote close family with us, because our understanding of close family includes not only your grandparents and your parents and your kids, it also includes your compadres, your godparents, right? And your tias and your, all that extended family, and some friends who have become like family. So when the government says, you know, you have to keep, you cannot have access or you cannot have contact with people outside of your family, in our heads, we already know that we can, in our understanding of family, we can communicate and visit our friends, our family, our relatives, our grandparents, our uncles and aunts, and padrinos and madrinas. So the message is not coming across because it's not designed to target this particular understanding of family, for instance, right? Which goes to talk about Marc's approach to the systemic way in which our communities are left out of the conversation and therefore left out of the solution as well. So, and I can go on and on that, but.
I'll let others jump in. Pam, Marc, would you like to add?
I would, because we are right now talking about the social determinants of health, and before we take a pivot and begin to talk about the intersectionality of coronavirus, I just want to give a real life example of what it means to apply the social determinants of health. And when we talk about our environment and typically the types of environments that people with means enjoy on a daily basis compared to folks without means, and how that shows up in people's lives and their health. And so I shared with some of my colleagues that several years ago, I became a kidney organ donor, and the recipient is also African American, and the surgeon was African American. And he made a comment that I found very curious. He said he was very pleased, but it was also so rare to have two African Americans in the operating room. And I was curious about that, and I began to do some research, some follow-up, and I wondered, is this because it is something that's a problem for people in our community? Is it just like a social stigma that we don't donate organs. But what I began to find out, and in a minute, this is going to really resonate with folks, that so many folks have underlying conditions that prevent them from being a donor. It's not that folks don't want to be a donor. It is because in Black and Brown communities, there's a higher rate of high blood pressure and diabetes and heart disease that preclude a person from being considered to be an eligible donor. So when I began to hear about coronavirus and underlying conditions and comorbidities and who's more at risk, I could really relate to that from a lived situation. And so if we, in our everyday environment, our everyday situations, we are being tested just to be able to show up and be a support to one another and to live healthy lives. When we begin to talk about something that's already doesn't discriminate against anyone, there are folks who are already essentially set up to be more vulnerable. And then the question becomes, why is that? Why is it that there are people who experience higher rates of this? It's not just because, it's not that people are lazy. It is not because people don't want to eat healthy. It's not that people don't want to take care of themselves, but it's the built environment, which has been structurally designed to benefit some folks and to be to the detriment of others. Marc, what would you add to that?
Oh, very little. I mean, I think that like the only other thing that I would do a little bit of a double click on is when Manny was talking about like the architecture of family and like the interrelationship between how systems will or will not recognize who you are in a familiar relationship with. I just think that's such a profound violence, right? Like, and I don't think we talk about that enough, particularly in the context of, and this actually could serve potentially as a bridge to the national conversation. So like most of my work for the last 6-7 years has been predominantly in the housing and homelessness space, right? And this is such a surreal time, right? And pandemics, I think, as disaster models, are quite strange because they don't have the physical destruction of like a hurricane or an earthquake, right? And so it doesn't feel like this is the kind of thing that will need like the scale of disaster recovery of like a Sandy or a Harvey or a Katrina, but it absolutely will. And like all of the federal conversations, you know, not those conversations, but the other ones. You know, the mayoral conversations right now across the country are about disaster response. And when we look, for example, at Katrina as one of the last, well, not the last, but one of the most recent incredibly racist disaster responses, right? What we see is that one of the long-term, still undone damages to communities is the way in which families were split up and flung across the country with no recourse of finding each other, no recourse of getting back to each other. And it was a profoundly racist set of policies that refused to acknowledge, right, what the bond was between a group of people and said, you know, if you don't have paperwork that has the right set of names on it, like, we are not obligated to keep you together in any way, shape, or form, right? So you go to the Superdome and you go to Mississippi and you go to the Pacific Northwest and like, that's your problem. And that trajectory, right, could very well play out again. and likely will, frankly. I mean, like we do not have the kind of system architecture that is going to prevent that from happening. I think we can try to slow it down. I think we can try to not let it happen at the speed, velocity, and volume that it did in some of those other events. But it is a really profound structural violence, and I think that we don't engage with it enough.
And can I say, one of the things that I notice here that I've noticed for a long time, and it continues being repeated time after time, is that the systems keep targeting those that have all the power, all the knowledge, all the privileges that the rest of us don't necessarily have access to. And every time that we quote unquote fix a system, we actually patch it, but don't actually address the needs of those that are at the bottom of the ladder, right? Like, for those who have the most challenges accessing education, accessing healthcare, accessing programs, accessing whatever it is that they need to access to thrive according to their own understanding of what it means for them to thrive, right? And that's one of the biggest problems that we're seeing right now with the response to the COVID-19, and is that the systems have never been designed to address the needs of those that need it the most. Right now, yes, the hospitals are there, but what is going to happen once that undocumented person goes to the hospital without having healthcare, without having the money to pay for immediately, which is the second question that healthcare, that hospitals ask you, after your name, what is your insurance? And so the systems are already designed to make us fail and then blame us for the failures of not choosing the right path to success. But that doesn't exist. So I think that I just sent an email earlier to my commissioners, and one of the things that I told them was, that I hope that we can actually change the systems now that we have an opportunity, because we're going to continue seeing these, patching the systems to make sure that the rest of us don't have access to the actual solution to the problems that we're facing. And that's something very important that we have to keep the conversation going and keep pushing to make sure that those systems actually change and address the needs of those that needed it most. Because once that we address the issues and the needs of those that need it most, every other issue, every other person, every other category, every other group is going to have access to that too. Because until and unless the person that doesn't have access to anything, doesn't have any roadblocks on their way to success, everybody else's roadblocks are left, are taken out of the road. So we have to keep that in mind.
Mm-hmm. So I'm gonna turn the floor over to you, Marc, if you're okay with that. Yes. So I'm gonna mute myself, and everyone, just so you're aware, I'll turn it over to Marc to lead us for the next several moments. Thank you, Marc.
No problem. So the national landscape that I can speak to best, again, is situated inside the context of housing. I am happy to, I can try to speak to other things in so much as I have seen them or interacted with them, and I feel actually knowledgeable about them. I am sufficiently old enough that I do not talk about things I do not know. So if I don't know, I will simply punt. But I think that the framework of the national response, and this I think gets to what I was saying about sort of the scale of those other natural disasters. I think, now 7 weeks ago, I recall being in a series of meetings with a number of other national leaders and saying, this is teeing up to look like a rehousing effort on the scale of Katrina in multiple cities, right? And I don't think it needs to look like that, right? I don't think we need to let the same racist set of systems play out, because we know where this is going, right? And we can choose to do better right now. And I remember being in a number of those conversations, and folks, sort of like, oh yeah, like that's interesting, but there was this fixation at the time that no, this is a disease that is striking the elderly, and is predominantly focused. It's in a lot of suburbs. It's blah 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 blah, right? And I remember thinking, similar to what Pamela was saying, right? That like, if this is a disease that like preys first on communities that have high rates of what we're now calling underlying conditions, right? Then like, there is no way this isn't going to burn through Black and Latinx communities. Like, it's just gonna happen, right? And now, like 7 weeks later, when that is the reality, and we know that, and the data is like, coming out more and more every day from every city, like, oh, yep, this is the thing. I first just want to situate this entire conversation in like, I was not the only person saying that. Like, I'm not some like super secret genius who understands like, how health and disease modeling works in historically marginalized communities. That is an abundant skill set, frankly. But the key problem was that I'm a queer Black person and I was the one saying it, right? And so when Manny talks about who we listen to, how we construct our responses, I think one of the things that has been so shocking about this national response is that over and over again, we have refused to just listen to Black and brown folks. We have waited for the data to catch up. And anyone who does any kind of disaster response can tell you, like, the data intake during disaster response is complicated on the best day, right? And like how you actually construct your sort of what's called a field model is a combination of data and what people are telling you, right? And then you just use your best judgment. But what we have found over and over again is that as mayors and governors stood up their command centers around COVID response, those command centers had no meaningful connections to historically marginalized communities. They defaulted to white dominant and incredibly hierarchical ways of pulling in information. And so as a result, right, like all of the sort of ground level information simply wasn't available to them. And so this belief, right, that like doing equitable decision making is this arcane process, that it takes longer, that you couldn't possibly execute it inside the context of an emergency, drove a profoundly inequitable response that we will spend maybe a decade sorting out. And I just think that's the most important thing to name at the outset. But it also, again, opens up an opportunity for how we might think about what the response could be, right? Like we could, in the vein of optimism, truly redesign stuff, but those redesigns that could happen now in community as part of the recovery work must actually include the voices of those who are most impacted. Mm-hmm. And they have to center those voices. It can't be, well, I put together the advisory committee of Black and brown people to like get recommendations that I didn't like, and so I didn't do them. Like that doesn't work. Mm-hmm. We actually have to like move power meaningfully into communities that have been disenfranchised and marginalized for 200 plus years and say, okay, like what actually should the plan be? And then just do that plan. And so what my team has been particularly focused on is, again, like, what does this mean for housing and homelessness? And I will say, again, in the vein of optimism, right now, because of the amount of ESG and CDBG, like if you don't know funding streams, that's fine, don't worry about it. It's just federal money, and there's a lot of it. Like the CARES Act put an unprecedented amount of money into communities, right? And there is likely more coming. And so communities that have never had this amount of resource now actually have the real opportunity to say, like, we could end homelessness. But ending homelessness is actually only possible with a racial justice lens, because the majority of people experiencing homelessness in this country, in every community, are Black and brown. That, I think, is the core to me of like what the national landscape looks like and where the opportunity is. I will say very explicitly, just, you know, to have said it, that when we talk about including historically marginalized communities, specifically we are thinking about Black folks, Latinx folks, Asian American folks, which is, I say this every time I say this, that is a bad category. It refers to a continent of people. It is really difficult to be clear who you're talking about when you say the words Asian American. I will specify that in this particular instance, though, we are seeing ramifications for East Asian folks and particularly Chinese folks. Right, like there are economic ramifications. Like I live across the street from an Asian market, which is a broad East Asian grocery store. It hasn't been depleted one time because folks are afraid to go there now, right? And that's the racism that has been embedded in how this pandemic has been publicly understood. That kind of, like, all the Chinese restaurants are closed. There are only a few Japanese restaurants that are still open, right? Like that kind of long-term economic impact is actually going to have to be accounted for in a different way than, say, Southeast Asian communities, right? Which are being impacted, but differently. And so we want to make sure that we understand the differences. I also want to make sure that we look at LGBTQ communities, right? I noticed that I'm pulling the T out there because what happens to trans folks is fundamentally different and needs to be considered fundamentally different. Like we gotta do right, particularly when it comes to housing, which is a whole long story. Undocumented folks, right? So folks who are undocumented and folks who are in mixed stock families or units, right? Like understanding the ways in which federal policy right now has cut undocumented folks off from any kind of support is really, really critical. Because it is creating, I mean, just from a public health standpoint, it's creating what we would consider to be like, we don't know how long this thing lives in people. We don't know how long you are, what it looks like in terms of latent transmission, blah, 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 blah. So there are whole groups of people who are going to be functionally cut off from any kind of care, testing, or support. And we just simply will not know, right, when disease flare-ups will happen in those communities again because of how deeply the federal government has disenfranchised undocumented folks. And again, the opportunity to fix that actually is at the local level, at the state level. And we can do a lot there. Folks living with disabilities, right? Native folks, and then folks who have been incarcerated or are incarcerated. Those are the folks who I really want us to be thinking about when I say we got to think about our historically marginalized communities. There are other people to think about. This is not an exhaustive list, but we should start there.
Right. Hey, we have a lot of comments that are starting to queue up in the chat box, the Q&A box, I'm sorry, and that's really good. I just wanted to remind folks that if you have any comments or questions, please submit those through Q&A, and then I'm now going to turn the virtual floor over to Manny, who has some follow-up to what Marc shared with us.
Yeah, I think that Marc touched on various things that are extremely important to keep in mind as we collectively as a community face, what is going to be our response to the current crisis and the extensive recovery that is ahead of us. I want to recognize that Marc mentioned something that for me is very, very important. Obviously, the LGBTQ community, that's the community that I work with, it's part of who I am. And he mentioned the importance of the trans experience and the way in which the trans community is experiencing these particular difficult times. And I want to tie that to what I said earlier about, caring for the needs of those who who have the most needs. And if we're looking at who among our communities are some of the people that have the most needs, those would be trans people of color, especially Black trans women. And if we go to those communities and ask them what it is that is important to your community so you can have the tools that you need as a community to thrive once that all this is over, and to help you navigate this while it's happening, if we get that, and if we act on that community, everybody else is going to have access to healthcare and to the tests that we need to make sure that we have accurate numbers on how many people out there are contagious, and and to actually address the needs of the larger community. And that's why it's so important to pay attention to those that have the least power and the least access to opportunities, and to have their voices heard. So that's one thing that I wanted to mention. The other thing that I wanted to mention in terms of the in the Latinx community, in the Latino community in general, there are so many challenges right now that our community are facing, and I wanted to share with you my own personal experience. I am not undocumented. I am from Puerto Rico, so I had the geographical accident of being born in part of the United States, so I have access to many things that my husband's family doesn't have access to. When within our family, within the family that lives here in Washington, my husband is the only one that has proper documentation to work and live in the United States. When all this started to happen, he was laid off. His whole family was laid off from restaurant work that they do, and it turned out that I was the only steady income, the only one with any stability in our family. And that is, it is a huge family. It's my brother-in-law, his wife, my sister-in-law, her husband, kids, a cousin, an uncle, and another cousin, all of us, all of them relying on my husband and I for financial support, for moral support, for mental support. And that's what we're doing right now, right? And this is not something that is affecting people out there. This is a situation that is affecting people here, right here, and people that are amongst you. So some people don't talk a whole lot about these issues, but we have to start putting faces and names to the numbers. This is actually one of the things that bothers me the most about the national response to these, that is all about numbers and whether or not we can dispose of how many bodies so the economy can flourish, right? No, those bodies, those are people that live with us, that we love, that we care for, that we cherish, people that we grew up with. And it's important for us to name those people, to name those situations, to name those realities, because it's the only way that we can actually move forward with actual solutions that place the people at the heart of the solution instead of the systems that continue oppressing us and continue keeping us from having access to the things that we need to thrive. So those are some of the things that I wanted to say. When in terms of the government and the government's response to this, one of the things that I can say right now, and yes, I am a government employee and I work with Governor Inslee, and I know that not everything that he or the administration is doing is perfect. However, one of the things that I've been really enjoying is to have the opportunity as a person of color, as a queer person, as a kid with an accent, to be at the table sharing with them my own concerns, my own story of my own struggle with our family. So those who have the power to make the final decisions know this is not affecting people out there in Yakima Valley and all the undocumented workers in Yakima Valley. No, they're making now decisions about, oh, Manny's family is going through this. So let's see how we can actually make something that helps those communities. And one of the things that we're facing right now is the challenges of how do we manage the federal regulations to support the communities with the reality that our communities are not what the federal government wants them to be, right? They are not all like two parents with kids in the suburbs and whatnot. So So that's one of the things that is most challenging right now. How can we as a government offer support to the families, to all of the families that need support right now, regardless of who they are, where they live, and what the needs are, with the restrictions that the federal government put on that CARES Act, for instance, and in other programs that are coming up. So that is where the wealth of knowledge from our community comes in, so we can actually go back to the table, people like me who are there at the table, and bring those ideas so we can actually find solutions to all of these. So yeah.
Thank you very much, Manny. Jacques, would you like to add to that?
Yeah, thanks for sharing that, Manny. And I guess I would add that as we talk about the disproportionate impacts of COVID, and I think the original question in this part of the discussion was around, like talking about the impacts. So in Pierce County, I just wanted to call out that there are 3 groups of folks that are disproportionately impacted by COVID, the disease, and it's African Americans, the Latinx community, and our Asian Pacific Islander community, right? So that goes very in line with the same inequities that we see across all of the other social determinants for all of the reasons that Marc and Manny and Pam have articulated. So that's an important first starting point for saying, we are addressing this crisis as a whole community, but if we don't recognize that there are specific segments of the community that are disproportionately impacted, we will never be able to have the kind of response and recovery that we need to be effective. That's number one. Number two is one of the ways to think about health or social determinants or stress is the idea of, adding more weight to something to stress it out, right? And one of the really important things about any crisis and just community resiliency is that different communities have been building different strengths of foundation to support different weights of stress. And so health, we've talked about, right? And you're seeing a disproportionate impact to the health of these communities because there are other stresses that have created what Pam was talking about with higher rates of pre-existing conditions, right? The second layer that I want to talk about in addition to that is you have an additional economic layer of stress. So while white families have been building wealth primarily through home equity for the past several generations, families of color have been, for the most part, excluded from building equity through home ownership. And as a result of that, who is going to be primarily impacted when jobs are lost, rent payments are due, mortgage payments are due, and a moratorium on evictions or foreclosures does not go on forever? Who is going to be most impacted by that? It's obvious that it's going to be families that have been prevented from building the same kind of wealth as other families. So this obviously doesn't apply across the board as a blanket statement, but we see in the numbers that this is a generality that happens throughout our country. And the families of color are renting at far higher rates than white families because of that as well. So that's another layer of stress on top of that. And then let's talk about jobs. So Manny was talking about his own family and what kinds of jobs they got laid off from. Well, who is disproportionately taking the low-wage essential jobs that folks have to go to, be disproportionately exposed to the virus, and then not be paid wages that are commensurate with the type of risk that they're providing to create what we deem as essential services. So I think all of those layers of stress, and I'm not even talking about childcare, I'm not even talking about other layers of this, all of those layers of stress are operating within the same groundwater of racism that Marc talked about at the beginning. And so when you think about each of these sectors as kind of ponds on their own, and you see the racial disparities within each of the ponds, whether it's housing or jobs or neighborhoods, conditions, like all of those ponds, there is groundwater underneath that is the systems that we're operating in. And that's why you see the same sort of patterns across health outcomes, housing outcomes, educational outcomes, et cetera. So I think it's really important as we talk about the disproportionate impacts of this in the community to, yes, recognize that they are happening and name them so that we can have effective responses to them, and also recognize why these multiple layers of generational stress and inequity are creating these outcomes that we're seeing flare up even more severely during a crisis.
Thank you, Jacques, Manny, Pam, Mark, for your comments. We have, folks have been listening, and so they have some questions and follow-ups. So I'm gonna go through the Q&A, and hopefully you have paper and pencil, because I wanna read off a few of them and you can kind of take note and respond as you choose, because we are up to 9. So I wanna go through a few and you can jot down some notes and respond as you wish. So we have a question in here, or it says it's just an observation. So the same violent diaspora played out in Hurricane Maria too, anticipating what that might look like with COVID-19 without that physical disaster element feels like it would be important to do in order to get ahead of it. So the same violent diaspora played out in Hurricane Maria too, anticipating what that might look like with COVID-19 without that physical disaster element feels like it would be important to do in order to get ahead of it. And that was from Jeff. I won't read names just in case some folks weren't hoping for their name to be, so I'll stop there. You want to comment now, or you want me to go through a couple?
Well, that's a good question. What do you want to do?
Since there are 9, let me go through half of them and you all just jot down the elements and then respond. So another one says, as we acknowledge that governments were responsible for creation and perpetuation of the structural inequities and racial disparities, why would the government have any incentive to want to correct these and work with community partners to create infrastructure for Black and Latinx families to thrive? Why should we work with these government structures or systems to try to create new systems for ourselves? And I think this is a follow-up to it that says, why would we even want to do that? It's from the same person. And then also, here's another one. We also need to see additional targeted focus on Native American communities. And then the last, before I pause, how can the average person help? And this is, we do have a follow-up question. So this is an extremely broad question, but still the curiosity, how can the average person help? And thanks. And this is just a comment for you all that says thanks. And one of you was so right that they are scared to ask for help in fear of being deported. So this was talking about our maybe undocumented and immigrant refugee community members. So I am going to pause there because there are several questions, and then let you all kind of fire away as you so choose.
I want to talk a little bit about 2 of the things. One is the comment about a very quick reply to the comment about the Hurricane Maria. My parents were there. I and my sister when it happened, and I think that the response just showed us what the not only the ability or lack of ability, but also the lack of interest on the federal government to actually reach out to communities of color. In this case was the Latinx community, the Latino community in Puerto Rico, but we saw that with Katrina, the same type of response to, in this case, a majority African American and Black communities. And I think that it's going to be the same. You know, we don't matter. They don't care about us, and we have to make sure that somehow we get a hold of the resources that are out there, that the federal government is putting out there. And this is where the second part of my comment goes, and it goes to address the issue about, or the question about how can we get involved, and is to reach out to our communities, to reach out to each other, and to let people know what resources are out there, because some of the things that are happening is that our communities are not completely informed. We already, for the most part, don't trust the authorities, because we know what the authorities and what the governments and what the agencies and systems have done to our community. So there's already mistrust, right? There's already the lack of trust of these systems. However, the money is there, the resources are there, and they're very complicated for our communities to navigate. But if one of us has the skills to navigate it, then to go back to our community and say, these are the skills that I have, I'm gonna help you figure out these so you can access that, those resources that are out there. I think that that's extremely important, and is a way that we can actually advance, our communities, and make sure that the resources that are out there get back to our communities. The other thing that is very important, I'm Latino, I'm very proud of my Latino heritage, I'm very proud of who I am, and I'm also in solidarity with the other communities that I know are suffering. Recently, I saw a conversation between a friend and his friend, and this other person, also a person of color, was complaining for, why should we take care of DACA students when this other community, my own personal community, hasn't received anything? Well, the reason is because we are all under the same stress, under the same systems that prevent us from achieving our goals and from thriving. And guess what? It is by design. It is by design that the systems don't want us to come together and find a solution for our communities, because as long as we stay fighting with each other and thinking that there's only a pie and that one of us is going to get one bigger piece than the others, as long as we continue to think about that or thinking in that way, we are never going to be able to advance and to actually transform the systems. So for me, it's very important to be in solidarity and to work with every other oppressed community, regardless of how close I am in my own identities to that community. Because if I work for and with the other oppressed communities, I know that my own communities are going to be successful. So that solidarity is important. If you are a Black person who speaks Spanish and can help an undocumented person to access unemployment benefits, do it, because we need to support each other in this time. And regardless of whether or not we understand every single aspect of every other individual's realities, we must be in solidarity right now, and we must educate each other on what the issues are so we can go together and not grab the crumbs, but actually make a space at the table ourselves.
So I will try to be very brief. So I think that what I heard in the question about Maria, or comment about Maria, was like, so in the case of physical disasters, the source of the displacement is very clear. And in the case of non-physical disasters, the source of the displacement is harder to pinpoint, right? So like, it is easier to model like from just like who is most impacted, right? Like when a neighborhood or a particular city is wiped out by a physical disaster. But when we're talking about non-physical disasters, the modeling becomes significantly more complex. And so this is part of the reason why, like what I was saying in terms of like beginning to understand where there are disproportionate economic impacts, where there are disproportionate impacts on family and community structure, is actually what is likely to give us the best sense of who's going to be forced into migratory patterns, right? Because of likely first housing insecurity, and then, choice logics or things masquerading as choice logics that are essentially forced choice. So that's just a really fancy way of saying, right? Like if I am part of a community that is sustained by a network of small businesses, and this has wiped out all of our small businesses, we will likely be pushed into a migratory pattern, right? We will need to go somewhere else that is cheaper. We will need to figure out where we're blah, 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 blah. We'll access federal resources or community resources to think about relocating. But there's a complexity in modeling who is likely to have to like enter that kind of decision-making process that's different than if like it was just like, well, you know, this city block is gone, right? So these people we know will need to move. And that complexity, I just want to say again, is only solved if we talk to people, right? Like, we won't know like where the community networks are fraying, where that stress, to Jacques' point, right, is accumulating if we are not in more of a robust conversation with people. So I think the comment is absolutely right. The modeling is much harder, and the solution is talking to people. I also just wanted to sort of briefly address the why would we work with government? Like, that seems bad. Yes, agree, hard agree. I will say personally, right? Like, and this is just like a brief anecdote. I promise to be brief. My degree is in psychiatric anthropology. When I was graduating, I was like thinking I was going to go med school, and then I didn't know what I was going to do. It was a very confusing time. And I remember having lunch with a friend's mother, who, queer woman, lawyer, and I was like, maybe I'll go to law school. And I will never forget, she sat across the table from me and said, if you think that going to law school will get you a seat at their tables, you are incorrect. And I was like, oh. and she was like, I just need to be really clear with you right now. I went to a very prestigious law school. I graduated and thought assuredly all these men who I sat in class with, right, for 3 years would make space for me at these tables. And that space was not to be found. And so, and what she said to me was like, if there's a table you want to be at, you need to start thinking now about how you make a seat at it, right? And I have been thinking about that on repeat now for like 15 years about like, what does it mean to create seats, right? And I fundamentally believe that the redesign of government, if government is truly to ever function in a democratic, equitable way, like real democracy, not the shit we run, real democracy, like that is about the creation of seats. And like, if we're going to live into that higher truth, right? Like, then I think that it is incumbent on some of us to take up the task of making the seats at those tables. I want to be really clear. That ain't for everybody. Not everybody wants that burden. Not everybody should have to bear that burden. And in fact, not everybody is called to do that specific kind of work. I work with organizers who are much, much better than me at like leagues at like work in community, organizing direct action, getting like, voter turnout. And I am like a weird policy wizard who's like, okay, I can braid these funding streams, I can figure out, and I can make sure that this committee is structured this way, and boom, here's a seat at this table. We require each other to pull off the grander vision that we are aiming towards, right? And so if you do not feel called to do government stuff and to like get in the weeds with distasteful, ancient, predatory systems, don't do that. Like, straight up. Like, the harm that you will cause yourself trying to do work that is just like somebody else's work is too high a price to pay. Do something else to benefit the movement and benefit the community, right? Like full stop. What I will say though is just to like double click on, it is necessary for us to find each other and work together, right? Those of us who can do that specific work, those of us who are better community organizers, those of us who are like incredible fundraisers, we all need to be in it together to make the vision that we are headed towards. Which incidentally is also what the average person does, right? Is find where your skill set is in that map. Like, you got something, there's no such thing as somebody who doesn't have nothing. So figure out what you got.
And I do work for the government, so I feel like I have to respond to that question. I think in Tacoma, we're actually in a lucky space where we have a local government that is explicit about recognizing the role of government in the creation of racial inequities and intentional about making investments to address them. And this is just the first part, because governments can talk real nice about stuff, so wait for it. But We have an Office of Equity and Human Rights at the city that I just want to call out, and that's not something that every local government has. And the work that we're doing at the city across every piece of work that we're doing is really trying to take the journey from predatory systems that are being talked about to something that's new. And that, as anybody who has worked in government knows, is not an easy process. It's not one that you have an 100% accuracy rate with, but it's work that has to happen. And for those of us like myself that have chosen to go into the belly of the beast, there's a philosophy that it's easier to make change sometimes from the inside than it is from the outside. And that is necessary, but change does come from the outside. And so to directly answer your question, it's nice that the city of Tacoma government is structured in these ways, is talking about our work this way, is trying to make active steps towards being a more equitable local government. And it is absolutely necessary that folks in the community hold us accountable to that. So I would say, trust but verify. It's great that we're talking about this, but we absolutely need folks in the community that are the voices that need to be centered, as Marc has been talking about, as Manny has been talking about. Those voices that need to be centered are the very ones that also need to be pushing the government. And so our role in the government is not just about, making decisions about what work needs to be happening and hoping that it's the right work to deliver what's needed. It's about creating the pathways to hear those voices. Marc talked about it as creating the chairs. There have to be ways of figuring out how to center the voices of those who are the most in need, the most affected, and having our systems shift to actually respond to what they want. So I say that, which sounds great, but again, trust but verify. Please do what you can to come together, to advocate, to let your city council people know what's important to you, what parts of the community you feel like are not getting the investment and recognition they need, because that is what moves people. So yeah.
And I would follow up to everything that was stated, which was so very powerful, that it is an absolute imperative for all of us to be working together. And that really gets to one of the additional questions that was posted later in the queue. Why is any one community more important? And we are not saying any one community is more important. We are saying that all communities need to be heard. And what has been very strongly made evident in this conversation that about the impacts of coronavirus on especially non-white communities is that there are a myriad of things. There are layers of impacts. As Jacques said, there are pools, but when we begin to look at what happens in the communities of those who, especially who are non-white, and how day-to-day stressors impact these communities, and then when you layer on top of that coronavirus, for which we are still struggling as a society to understand how it shows up, and just how do we handle this? We're wrestling with this. It's important to understand that it's even harder for our communities, and that it is an imperative, again, that we address, that we be proactive in addressing and stepping up and being very vocal to ensure that folks who are not typically in these spaces, because we've made a space here for ourselves, but there are so many folks who are not in these spaces, don't know what's going on, and don't feel any hope.
Can I say something about that question too, about why focus in one community when the virus doesn't discriminate? That was kind of the question that was raised. And it is true that the virus doesn't discriminate. However, the systems in which we interact every day, they are where you get infected. It really depends on what type of work you do and what type of interaction you have with the community. And our communities of color, are exposed more than other communities. And that's why, even though the actual virus doesn't discriminate and is going to affect and infect whomever it comes in contact with, the truth is that the virus comes in contact mostly with communities of color because of the type of services that we provide, because of the type because of the systems in which we work. So yes, the virus doesn't discriminate, but our communities are providing services and working in fields where the spread is more prominent. I want to throw a statistics, for instance. The Latino community makes up about 13% of Washington residents, and because of the type of work that our community does, and because of the lack of access to education about how to prevent the spread of virus, access to information in our languages, not only Spanish, but also indigenous languages from the Americas for temporary workers who are here, who don't speak Spanish as a primary language, but are Latinos. And because of all those compounded realities, 33% of of all cases, confirmed cases of COVID-19 in the state of Washington are Latinos, but we only represent 13% of the population. And these are only the known cases, because as we all know, we've had a lot of challenges getting tests. So we haven't been able, as a state, we haven't been able to test that many people. So of all the cases of COVID-19 in the state of Washington, 33% are among Latinos and Hispanics, and we only represent 13% of the people. And you see there that, yes, the virus doesn't discriminate, but the systems that make us more vulnerable to the virus do discriminate.
Thank you all. I'm going to, a couple of things. There are a couple more questions in a Q&A, and I want to be respectful of those questions. And then we do have just some final thoughts. So if you have your pad and pen again. See, are there local entities keeping statistics on those being laid off or losing their jobs to monitor disparities in race, gender, ethnicity, sexual orientation, and disabilities? If so, are those comparisons readily available to the public? That's one question. Another, maybe it is a question. Okay, so grand families is higher and brown families. COVID-19 is impacting the grandparents and economic support, leaving a generation that was already stressed without natural supports due to drug use, mental health, and incarceration. Where do we go from here to have an impact on the disproportionality we will see with young children and young adults being left behind? And then I'll do two more. Can we begin direct funds to pay people from the most vulnerable communities as content experts so that we create seats that permanently put the people most impacted into essential conversations and compensates them for their time rather than constantly expecting volunteers? And then a last one, I'm watching people who are still working, grieving the loss of normal and not talking about it, feeling isolated emotionally as well. There's fear and lack of trust, or fear and lack of trust appears to be on an increase. So more of a comment. And then I'll just read these last two. Let's see, this says, this is just an update from a previous comment about like one group being prioritized over another. The comment is just, I work in a criminal justice field. I said we are one community with several obstacles within the communities of color. Absolutely true. And then the last comment, thank you all for sharing your expertise. and creating space for this critical discussion. Gratitude for your work and leadership. So I will mute, and then however you would like to respond to those questions, and let me know if there was one that I should repeat. Okay, I'll turn it back over.
So one thing that is very evident that we actually have not really talked about in this particular conversation is the behavioral health impacts of coronavirus. And so many of these questions and these comments speak to that. It elevates the need to really be focused in providing behavioral health supports to our communities, which, by the way, are already underserved when we talk about mental health counseling. There's social stigmas associated with that, but this is the time to really pull out additional behavioral health supports, whether it's outpatient counseling or whatever, so that so folks can know that we care about them and that it is okay to say, hey, I'm really having a hard time right now and I need some help.
Yeah, I would, that segues into the what I was going to talk about, which is largely the sort of, I obviously can't speak to the local initiatives doing data tracking. I hope that's happening. It feels like that's probably a thing that's happening. But the natural support issues are significant, right? And so what I would say is that, like, this is not the first time for marginalized communities that we've seen this winnowing of elders, right? And it's not great. It's not great. And the disruption that it creates to not just units, right? But like there is a cultural erosion that happens. There's a lack of capacity for communities to care for themselves that happens, right, when you begin to take away the elders, right? So I do think that is a thing that we want to think about preemptively as we begin to, again, think about like what the structures are that we want to build coming out of this. Because I think that, you know, there are a lot of things, frankly, that we could do. Again, sort of returning to Manny's point, if we open up pathways right now around chosen family, because I think that we'll just need to, right? Like we'll need to create pathways and programs and funded support mechanisms inside which elders are able to support groups of folks who may not necessarily be like theirs by blood, but are theirs. And so that actually jumped out to me, and I just wanted to double click that. The other thing that I would say, just briefly by way of systems design and coming all the way back around to that concept of stress, is one of the things that I ask my team a lot, or our clients with, you know, mostly governments, but when we're looking at a system that is a helping system, oftentimes the question that I ask folks is, cool, when you interact with this, do you feel ease or do you feel stress? And if it is a helping system, but when you touch it, it stresses you out, it'll help. And so what I really want us to be thinking about as we think about the redesign here and the opportunities is the creation of systems that actually do create ease in communities, right? And what does that look like? And what does it mean? And what it, like, blah, 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 blah. And again, it comes from taking an actual strengths-based approach and saying, what would thriving look like for this community, as opposed to simply eliminating things that we understand to be negatives. And how do we have that conversation, which links into like absolutely everybody who participates in the design of a system, anyone who's like lending their expertise, is sitting at one of those seats at the table, needs to be compensated. And the last thing I will say about that is that my hope is that one of the ancillary effects that comes out of this is we start to understand different types of knowledge and privilege them as equally important. And the reason why I say that is that like we have a history of taking folks of color and forcing and really all historically marginalized folks, right? And forcing folks to achieve certain educational outputs or accreditation outputs in order to be accepted as valid, right? And the question of whether, like, this is the thing I've done all throughout my career. I sit down, I look at something that I've just done, and I ask myself, did I know this before I went and learned it? Like, was this just, like, am I just taking a thing I knew when I was 15 and wrapping a New York University degree around it? A lot. That happens a lot, right? And so the question I think we need to ask ourselves is, when do we force people to show up via certain pathways that legitimize the knowledge they have, right? Versus when we just say like, okay, like you said it, so it seems true. And who do we do that for? Because there are certain populations that, like you can guess, that we just automatically listen to. And then there are other populations that we test everything they say, right? So it's like, if you show up and you tell me your community is suffering, I'm like, that's very interesting, but I'm gonna need to see the data. And like, we don't ask that of everybody else. So there's an opportunity here for us to radically interrogate what constitutes knowledge and what constitutes the level of expertise someone needs to have in order to participate in a policy discussion. And the last thing, I swear to God, the last thing I will say is that it is a hallmark of oppressive regimes to create a bureaucratic class and isolate them from everybody else through the creation of technocratic knowledge. A hallmark. That's like fascism 101, to be honest. And so we should be deeply suspicious of government telling us that its functions are too complicated for its own citizenry to understand. That is never acceptable.
Amen, brother. Jacques, do you have
so
any?
you all know I'm clearly a socialist. I'm not like, I'm just like.
That was great, Mark. I've thought about that and talked about it, like overvaluing content expertise and undervaluing context expertise. And that the communities that are closest to the problems and have the most context expertise are the least valued, the least listened to, the least compensated. And instead we spend hundreds of thousands of dollars to pay consultants from a different place that have degrees to come tell us what their analysis of the problem is with no understanding of the context, but just with the content expertise that they carry with them. And so I will just say yes to that, Mark. And I will also say that the question about, can we pay people that have the close context expertise so that they permanently have a seat at the table? Yes, I think that should be the goal, right? If we can find money to pay consultants for content expertise, we can find the money to pay the people who we're trying to help for the context expertise, because guess what? That's the stuff that's actually going to make it work. You can come up with the best answers that will not work if they do not have the right context. So that's absolutely the right way to go. And I also want to say that from a government point of view, that's getting harder and harder, because if you think about how the coronavirus is actually impacting our community, we've talked about a bunch of the community impacts and how communities of color are disproportionately negatively impacted. We have not even talked about how the city governments that are trying to address these problems are being negatively impacted right now. So like the city of Tacoma, as an example, we're having to make really difficult decisions as we're getting deeper and deeper into the deficit that we're facing, because the places we get our money from, like restaurants operating, aren't operating. And so there is less money to actually do the things that we are talking about. So when we talk about, valuing people for their content expertise and their context expertise, it's getting more and more difficult as cities are having to make decisions about laying more and more staff off or what are essential services, and trying to recognize that the deficits in the community are getting more and more challenging. Anyway, this has been a great conversation. I really appreciate the opportunity to learn from everybody.
Absolutely, same here. Thank you so much. This conversation became far broader than what we had envisioned, and it's really good, because really what needed to be elevated is again, the myriad of ways that the coronavirus is impacting in a disproportionate manner non-white communities. And there were so many aspects of it that haven't even bubbled up until this conversation, and so many disparate ways that folks are being impacted. So I think it is actually the beginning of a longer conversation. Twina and I will be talking about that, but we accomplished what we wanted to accomplish. And that was just to have a conversation so that everyday people could hear and understand about how coronavirus is impacting our communities. Thank you so much to Manny, to Marc, to Jacques. As Twina mentioned earlier on, we will be here for the duration of this crisis. We are committed to elevating issues, and we also want to talk about that there is hope even in this pandemic. So again, we want to thank everyone who called in. We thank you so much for weighing in, for those who posted their questions and their comments. Thank you so much again to our panelists, and I want to thank my co-host, Twina Nobles of the Tacoma Urban League. Again, I'm Pam Duncan with Metropolitan Development Council. We thank you, and we wish you all a good evening. Good night, everyone.